Hi, I'm Dr. Max Lingenfelter, and welcome to our video on knee replacement recovery protocol. This is the general timeline I would anticipate for most of my patients. On the day of surgery, you will be up and walking just 2 hours after surgery. Studies have shown the faster you walk after surgery, not only the faster you recover, but the better your recovery ultimately is. At first, you will use a walker to help assist and offload the joint and provide maximum stability. In the first 1 to 2 weeks, you will be able to walk around to CVS or Walgreens. With more physical therapy shortly after, you will transition to a cane or walking stick in the 3 to 5 week window, and you will be tackling stores like Target or Walmart at that time. After about 6 to 8 weeks, you should be walking almost as much as you want, at which point you can hit up Costco or Sam's Club, and likely getting rid of the cane, as long as the cane is not necessary for some other limitation. Physical therapy will happen twice a week for those 6 to 8 weeks, so you will have approximately 12 to 18 visits with your physical therapist. Here's a depiction of the same information, demonstrating it takes some time for the pain and swelling which follows surgery to decrease and your stamina and endurance to return. There can be days initially that pain can range from 6 to 8, especially in the first several days following surgery, but it should quickly taper off to the 4 to 6 range after the first week and further down to the 2 to 5 range by week 4. Your stamina initially will be quite low and you will be going for very short, frequent walks. But by week 6 to 8, you should be reaching 80 to 90% of your walking stamina that you had prior to surgery. I always tell patients that following surgery, you will be facing a difficult task, which is the balancing act between activity and swelling. We want you to focus on activity, range of motion, stretching, walking, and strengthening, but all of those things are associated with swelling, and thus on the other side of the equation needs to be rest, elevation, icing, a precise pain control regimen, compression, and a mindfulness regimen as well. Swelling can be episodic and mostly associated with long periods of standing, activity, or physical therapy. Bruising and numbness are totally normal and expected following a reconstruction of a large joint like a knee. This bruising can occur anywhere from the groin to the toes and can occur anytime during the first 2 weeks. A quick note on elevation is that most people get this wrong. Here's an example of the perfect way to elevate your leg after surgery. You want 3 to 4 pillows underneath the ankle or the calf. The higher the better. What you want is a straight line from your ankle to your knee to your hip. This will maximize gravity's assistive force of driving the fluid back to your pelvis. Think of it as a waterfall. You want everything flowing downhill. Now, this is an example of how you do not want to elevate your extremity. Do not encourage or allow bending at the knee. This will slow down the healing process and result in suboptimal outcomes. You may experience pain around the thigh, which actually is the result of a tourniquet that is used during the operation to help minimize blood loss and to aid the surgeon in visualizing the tissues we are repairing. This should gradually resolve over the 2 to 4 weeks following surgery. It should be noted that some amount of swelling, which is typically associated with activity like walking long distances or standing for extended periods of time, can remain for 3 to 6 months following surgery, sometimes up to 12 months in rare circumstances. Numbness is entirely expected around the incision and especially on the outside of the leg just beyond the incision. This numbness will gradually recover over the year following surgery. This is because nerves grow very, very slowly, about 1 millimeter a day or 1 inch per month. When nerves begin this recovery process, hyperesthesia or a great sensitivity on the skin may occur. This is because as those nerves are regenerating, they are very sensitive. So things like a sheet or clothes or a light touch can result in quite an intense feeling during this time. Do not worry, this is totally normal during the recovery process and will improve with time. It can also be improved with lidocaine patches. This is an example of an ice machine, which I would highly recommend getting prior to your surgery. Generally, these are unfortunately not covered by insurance, but can be very helpful in tackling that balancing act between swelling control and activity. They can be ordered online or purchased from a medical supply store. They typically range from $130 to $200. This machine is called RomTech. It is an extremely helpful tool in expediting and ameliorating many of the unpleasant aspects of the knee replacement recovery by keeping the knee moving. It seems counterintuitive, but the more you move your knee during the recovery, the less it will hurt. This is basically a guided PT session in the comfort of your own home that walks you through various modes of passive or active assistance with varying degrees of resistance and can even adjust the degree of flexion occurring in your knee to maximize your range of motion and expedite your full and active recovery. These are covered by nearly all insurance companies, including Medicare, and it is delivered to your home and returned after the completion of your recovery. I routinely order this for nearly all of my knee replacement patients. Do I need someone to stay with me after joint replacement? Yes, generally you do need a support person following joint replacement, but it might not be for as long as you think. Generally, it is recommended for someone to stay with you the first few days up to 1 week. This is for activities like preparing meals, doing any necessary stairs, grocery shopping, and assistance with mobilization. After this short period of time, most people are capable of caring for themselves. It can be done alone in rare circumstances, however, it is not desirable and requires extensive planning for all logistical concerns. During the initial recovery phase, you will not be able to drive, and this is the biggest assistance most people require because you will need to travel to your post-op appointments and your PT sessions via another driver. When can I drive? Driving after joint replacement is a personalized and nuanced decision. In general, you may be able to drive 2 to 7 weeks following surgery, which should be discussed with your surgical team, including your physical therapist. In general, hip replacements tend to resume driving slightly earlier than knee replacements, but before you start this process, a few things need to happen. First, you need to be off of all prescription strength pain medicine while driving specifically. This does not include at night or following PT sessions. This also does not include over-the-counter aids such as Tylenol or ibuprofen. Second, your time to applying the brake and responding to an emergency situation needs to have returned to your baseline. Third, you need to have full proprioception or sensation in your foot as compared to pre-op. And lastly, you need to be confident that you can fully apply firm pressure to the pedals with no apprehension regarding pain or discomfort in the replaced joint. Many patients ask if they can go to rehab following a joint replacement. I find that the vast majority of patients do not need to go to rehab, and even some that end up making it there find they want to leave as soon as possible. Generally, rehab facilities, skilled nursing facilities, or nursing homes are for sick patients who cannot care for themselves, and therefore the services are geared around those needs. You will get the best physical therapy and rehabilitation protocols by going home to sleep in the comfort of your own home and going into the office for physical therapy where they can help drive your recovery and in the right direction as fast as possible. The determination on whether or not an insurance company will pay for rehab following joint replacement is made during the post-operative physical therapy evaluation. This is done the afternoon following or the next morning after surgery. Unfortunately, joint replacement surgeons have no control over this determination, and therefore we cannot guarantee a patient will be approved for rehab until after the operation is done and the physical therapy team performs their evaluation of the patient's physical capabilities. This is how insurance companies determine what they are willing to pay for. Following surgery, we like to use a three-tiered pain control strategy, starting with a baseline of Tylenol and ibuprofen, which can be alternated in a synergistic fashion every 3 hours. If more pain is present beyond this, tramadol can be utilized. Tramadol is a nice halfway step between the over-the-counter medicine and the more heavy-duty pain medicine. It is much less habit-forming and also much less likely to make you feel drowsy or somnolent. For this reason, I recommend it as a second-tier pain control. After taking tramadol, you should elevate, ice, and rest the joint for 45 to 60 minutes to allow the medicine to work. If there is more pain beyond that, there is always oxycodone, which can be utilized as a third-tier pain control measure. If you have a negative reaction to any of these medicines, you should stop the medication immediately and notify your care team to discuss alternative pain control strategies. Additionally, it should be noted if you cannot take NSAIDs like ibuprofen for any medical reason, your pain control journey will be more challenging, and therefore you must get extremely focused on icing, elevation, and mindfulness. To be more detailed, here's the three-tiered pain control regimen. Tylenol, 1000 milligrams, should be taken around the clock on a scheduled basis for the first 3 to 4 days following surgery. The same is true of ibuprofen, 600 milligrams, which should be taken on the clock for the first 3 to 4 days. This should be combined with rest, ice, and elevation. The Tylenol and ibuprofen is scheduled every 6 hours. They should be staggered so that every 3 hours you are either taking Tylenol or ibuprofen. This offers a very even pain control regimen, which should take the edge off, even if it doesn't completely relieve the pain. If more pain is experienced, the tramadol should be utilized on an as-needed basis, determined by your individual pain level. I would recommend waiting at least 45 minutes to an hour, during which you should be elevating, icing, and resting the joint, as well as practicing mindfulness. If you have persistent pain 1 hour following this, you should use oxycodone on an as-needed basis, determined by your unique pain level. Tylenol and ibuprofen should be limited to a maximum of 3 doses per day. Tramadol and oxycodone should be limited to dosing every 4 to 6 hours. After the first 3 days, I recommend switching to an as-needed basis for the Tylenol and ibuprofen. Here's an example of the pain control regimen with a patient waking at 9 a.m., at which time I would recommend taking ibuprofen with your breakfast. 3 hours later at noon, Tylenol should be taken. 3 hours later, ibuprofen should be taken with a small snack. 3 hours later, Tylenol should be taken. 3 hours later, alternating, at 9 p.m., ibuprofen should be taken with your dinner. Additionally, this patient went for a walk around 10 a.m. and came back and had some increased pain. Therefore, they took 1 or 2 tablets of tramadol and rested, elevated, and iced their joint. Later in the day, they went to a PT session and preemptively they took 1 or 2 tablets of tramadol to assist with pain control. After their PT session, they had persistent pain not relieved with ice, elevation, and rest, or mindfulness, and therefore took 1 or 2 tablets of oxycodone. Paying careful attention to their pain and is using as little medicine as possible to control the pain. And if you have pain at night, you should treat it similarly to during the day, either with tramadol or oxycodone. When to wean off prescription strength medicine like tramadol and oxycodone. This is a gradual process that you should begin around the 2 week mark following surgery. Pain medicine still may be required around periods of activity like physical therapy or prolonged periods of walking or prolonged standing. These can result in pain and swelling and should be treated appropriately as needed with pain medicine. But the process of stopping the tramadol and oxycodone should begin around the 2 week mark. Everyone is different following joint replacement, and you must find the pain medicine schedule that works best for you. Some people find the time of sleep is the last time they still find themselves needing pain medicine in order to get appropriate rest and recovery. By the 6 to 8 week mark following surgery, you should be completely off of pain medicine unless it is needed for an intense PT session. During this process of weaning off, lean into the Tylenol, ibuprofen, icing, and elevating. Many patients ask, can I perform stairs immediately following joint replacement? Yes, you can perform stairs immediately following your surgery. This is in fact something you must prove in practice with our in-house physical therapy team prior to leaving the surgical facility. You will simply use the unaffected leg to lead to go up first. This leg will power your body up and the surgical side will just be along for the ride. In general, the fewer the better in terms of stairs in the first several days. Make sure to utilize a partner when first performing stairs at least the first few times. Also, consider staying on the first floor as long as there is a place to sleep and to use the bathroom. You can also consider staying with a family member who has fewer stairs or even a hotel for the first 2 to 3 days to simplify these logistics. When can I fly? After a large joint replacement like a hip or knee, flying is generally not recommended for the first 3 to 4 weeks for domestic flights and 6 to 8 weeks for international flights. You should continue your DVT prophylaxis or blood thinner prior, during, and upon arrival from your trip, all the way up to 2 weeks following your return date. This is to help prevent blood clots or DVT from occurring. You should monitor for symptoms associated with the blood clot in your calves, such as significant and increased swelling of the calf, redness of the calf, increased and unnatural warmth to the calf, unusual pain in the posterior calf, particularly with bringing your toes up. Those are all symptoms to be on the lookout for. Additionally, you should monitor for symptoms of a pulmonary embolism, such as difficulty breathing, being short of breath, tightness in your chest or your left arm, or sharp pain running down your sternum. This is a very rare occurrence but can be life-threatening. During your trip, you should take preventative measures also to help prevent blood clots, like wearing compression stockings, performing ankle pumps while seated, and staying well hydrated. If you have any history of prior blood clot, DVT, or pulmonary embolism, you should avoid travel for 12 weeks following surgery. This is also true if you have a history of a clotting disorder. If you would like a letter from your care team regarding your recent surgical procedure and you feel you may need assistance, such as a golf cart or wheelchair, please notify your surgical care team. Do I need a card for TSA or security while flying? No, you do not need a card. You can simply notify the agent at the scanner that you have a joint replacement. The scanner may beep, but you do not need to show them your incision or any proof to that effect. They are very used to seeing joint replacements all day, every day. Sleep is a critical part of the recovery from a joint replacement and can be one of the trickiest and most difficult tasks to master during your recovery. This process begins in the weeks leading up to your surgery. The best scientific evidence in the field suggests optimizing strength, optimizing and strengthening your healthy sleeping habits leading up to surgery. This is because if you get to your day of surgery after weeks of poor sleep, it is much more difficult to recover quickly. This process begins by focusing on what's called sleep hygiene. It's a funny word that means all of the things you do right around the time leading up to sleep have an immense impact on the quality of sleep that you receive. This includes avoiding naps during the day, no cell phone or screen time leading up to bed, no water for at least 1 hour prior to getting in bed, avoiding heavy meals, no PM caffeine, no nicotine or alcohol, and setting the getting in bed time and waking times in stone leading up to surgery and sticking to it every single day. Many studies have emphasized the extraordinary benefit you can get from performing a 20-minute cool down period prior to sleep. You can call it meditation, you can call it a period of mindfulness, whatever you call it, it can be extremely transformative in creating healthy sleeping patterns. Meditation works with scientific data to back it up, so try it. After surgery, additional measures should be incorporated to address postoperative pain. Diclofenac cream immediately prior to bed should be applied to the sore spots to assist in sleeping. Staying on a well-outlined pain medicine schedule is extremely important for restful sleep, and some patients need to schedule medicine prior to sleep as well. Incorporating a mindfulness period after waking has also shown to be extremely helpful in reducing stress as patients go through the healing process. By doing this, by acknowledging the factors that affect your sleep, you can greatly expedite your recovery process. Studies have shown that improved sleep improves pain greatly following joint replacement. If you suffer from poor sleep prior to surgery, this should be discussed with your primary care physician ahead of surgery. Other things that can impact it would be spinal anesthesia rather than general anesthesia at the time of surgery has been shown to reduce sleep disturbance postoperatively, as well as going home after surgery has been shown to significantly improve your sleep quality. Lastly, sleep aid tablets can be helpful in the immediate postoperative healing process. 5 milligrams of melatonin or zolpidem or Ambien could be necessary to be incorporated in the recovery window, which you should discuss with your physician. And I will tell you, unfortunately, sleep is one of the very last things to go back to normal following a joint replacement. But the good news is, once this becomes your biggest limiting factor and your focus, you have started to see the light at the end of the tunnel. You will likely experience some symptoms in the knee for up to 3 to 4 months from the date of surgery. This can be minor aches and pains and usually associated with certain activities and swelling. Usually around the 3 to 4 month time frame, you will begin to notice that other sources of pain will start to present themselves, like an old shoulder injury or low back pains that you haven't really noticed since prior to surgery, basically indicating the replaced joint has fallen off the top of the list of your concerns and we are getting back towards normal. Lastly, it is important to keep in mind we did this for a reason. We tackled this life-changing operation to give you mobility, health, and mental well-being, to be able to do what you love doing for the rest of your life. During the first couple, sometimes the first few weeks, you will question your decision to have surgery and wonder if it was worth it. I always tell patients at the first post-operative visit, kind of jokingly, we will be friends again soon. And to keep in mind, if everyone stayed as miserable as they are the first 1 to 2 weeks after a knee replacement indefinitely, no one would ever have a knee replacement. It wouldn't be as incredibly common and ubiquitous as it is in our society if their function and satisfaction did not continue to improve. Yours will improve. It is a matter of time. I like to say it's like a tough college experience or going to medical school. The first year is the worst, the first semester, the first class, the first exam is the hardest, and each subsequent week becomes easier and gets better. It is important to pay attention to the trend of your pain and function more so than the moment by moment degree or amount. As long as things are steadily improving, we will get right where we want to be. This has been our presentation on recovering from your knee replacement surgery. Thank you very much for watching. If you found it helpful, please like and share with any friends and family who might benefit as well. Thank you very much and have a great day.